Good morning, Illini. Welcome back to Healthy Illini Podcast. I'm your host, as always, Matt Schrock, and we're glad you're with us today. You've been with us on this journey. It's been a lot of fun. Been a lot of topics, and we have another one. At some point, I always think we're going to run out of topics or something that we haven't addressed fully. But today's another one that's kind of new to the program, and it's an important one. And I'm really excited for our guest today, and so I want to jump right into it. Today, I'm joined by three of the staff we have here at McKinley Health Center. First off, we have Dr. Robert Parker, and he is the former director here and has now taken a role in the clinic to see students a little bit more frequently. And he's a returning guest on this podcast. So, Dr. Parker, thanks for being here.
Hey, great to be here.
I'm also joined by another repeat guest, Todd Johnson. He is a nurse practitioner here at McKinley as well, and you've heard his voice a number of times on a number of topics. Todd, thanks for joining us again.
Good to be back, Matt. Thanks.
And today I'm joined by a fresh face who's about to become a returning guest. We have her lined up for a couple things here this spring. But Denisha Moore, and Denisha is the sexual health educator here with the health ed department. Denisha, thanks for joining us this morning.
Absolutely. Good morning, everyone.
So today we're really focusing on what we're calling men's health. And there's two specific topics that we want to talk about, because when you talk about something, whether it's men's health, women's health, transgender health, whatever you want to call any of those, that's a very huge umbrella and lots of things. And it's impossible to talk about all those topics in one podcast, obviously. But there were two, as we were preparing, as we were getting ready for this kind of podcast, there were two specific topics that kind of popped up or came to the forefront that really a lot of young men on this campus are commonly impacted by, or may not realize that it's something that it's so common on campus. And so the first one we're going to start with, no matter where you are on campus, fitness crosses your mind at least once. If you've heard about it, people talk about fitness. We talk about health and wellness a lot, talk about the rec, campus rec and things like that. And so no matter where you are and no matter what you've heard about it, everyone it wants to take steps in their fitness journey, or wants to take steps of being healthier and things like that, and what fitness means for you and figuring that all out. And because of that, a lot of young men are interested in that subject as well. For a lot of men specifically, it could mean joining a club or a rec team or to play sports, and sometimes it means just to work out to build muscle mass. Those are kind of two examples. But what I want to chat with you about is in that area of building muscle mass or working out, we're hearing a lot about an increase in use of androgens and anabolic activators to help enhance that muscle mass and body image. So those are some big words. Let's start there. What is an androgen? What is an anabolic activator? What are we talking about?
Well, I'll kick it off, I guess. It's simplistically, an androgen is just a male hormone-like molecule on the cells in our body, essentially all of our cells. We have these receptors, and if a molecule attaches to an androgen receptor, it either revs the cell up or turns the cell off. And so a lot of students will seek out androgen-like compounds in order to basically build muscle mass. And although androgens are illegal to be sold in the United States, they're readily accessible, and we do find that students take them.
So when we're talking, you're not talking about supplements you would get at like Walgreens, or supplements at like a GNC or something like that. This is something outside of that kind of conversation.
Correct. GNC, for example, would not be legally allowed to sell androgens in the United States.
How does someone use an androgen? Is it a pill you take? Is it shots? What's the delivery method basically of how someone would get involved with androgens?
Yeah, well, anybody can jump in, but most of the androgens that, at least that I'm aware of, are either in liquid form. People will drop them into liquid drinks. They can be injected. I'm actually not aware of powdered androgens, though there may be some in the market. I'm just not aware of them. I don't know, Todd or Denisha, do you know?
I would think that most people are getting them from a source where they shouldn't be, for starters. And, whether it's an injectable or a liquid form that they're putting into a drink, they're coming from places where somebody had a prescription for them, or somebody got it from somewhere where there was a prescription for actual medical use for somebody who is, low in a certain area of a hormone, or having growth problems or things like that. Unfortunately, those things can be readily available to students on campus, and easily abused.
Okay, so let's talk about that, the abuse side of it, because you're talking about building muscle mass. That's a good thing, right? I mean, that's what we're talking about, is building muscle mass. So if somebody's listening, they're going, well, this is not bad. I'm getting healthier. I'm getting bigger, or whatever. What is the negative to taking an androgen, or what's the risk here?
Well, there are a couple, but obviously the overarching topic today is erectile dysfunction. And when you take an androgen, it shuts off your the cells of your testicles, and so your testicles then no longer are producing testosterone, and your testicles are no longer producing sperm. So the sperm counts go down, so your reproductive capability, if that's important to you, goes down, and your testicles get smaller, and all of that then can lead to erectile dysfunction. There are other problems with androgens, in that androgens fall into a class of drug called steroids, and that can affect your immune system and actually make you more susceptible to certain diseases, and it can destroy tissue. Steroids can destroy some of your good tissues, because, as I said, androgen receptors either turn on a cell or turn off a cell. And so if you're taking an androgen and it turns off the cells, that means that the tissues associated, actually, just like your gonads, they get smaller and degenerate.
Matt, we have two common problems that people come to us for here at McKinley: acne and hair loss. I mean, we get that all the time in this student population, and those are very common side effects of the use of these type of products in people. They have acne on their back and other parts of their bodies. They lose their hair and different things like that. So, it's interesting that those are two of the most common reasons we see people here at McKinley, yet they're the two most common side effects of abusing these type of products.
Yeah, that's an excellent point.
Well, and I know there is, when you start working on yourself and start getting healthier, there can be risk that then you feel this pressure to continue. You start working, like for me, when I started working out when I was younger, I started building some muscle mass, but then I plateaued a little bit, and there was a risk to try and find ways to get past that plateau, and steroids was an option out there. Thankfully, I had just enough of my own self-awareness to know that was a bad idea for me because of my personality to get into any of that. But there is that temptation to push yourself to a limit by using this type of supplement or this type of extra help, but it does run with that risk. Are there risks? We talked about, some of the other tissues that shrink, the hair loss, the acne. Is there health risk as far as cardiovascular or anything of that nature if you use this kind of enhancement?
Yeah, there are. I can't speak to it specifically, but androgens do have a negative effect on the heart. It does. Just males in general have more problems with heart disease than women do, and that in part is felt to be related to just your natural androgens and the effect on heart. Obviously, if you're taking additional androgens, that problem just gets exacerbated all the more. while it builds muscle mass, it actually has an adverse effect on tendon strength. And so actually, while you may look better in terms of your muscle contour and that sort of thing, you actually increase your likelihood of injuring yourself. And that can be an androgen effect as well.
I do want to come back to the androgen conversation just a little bit at the end. But before that, Dr. Parker, you raised the second part of this podcast that we're talking about, and that's erectile dysfunction. And I know that there's likely somebody listening that it was like, oh, androgen is kind of uncomfortable. Erectile dysfunction, okay, that's a real uncomfortable topic to talk about. And got like, oh gosh, this is not what I want to speak on. But it's important. It's important that we need to talk about, and it's important to be aware of and to destigmatize some of that conversation, because it is an issue that faces college populations, or college populations face. And so I do want to talk about that, because I know as a young man I thought, oh, that's an older man issue. And part of that is the media that's around it, because any marketing that goes, Viagra or anything like that, the marketing, it's often older generations that are depicted in that. But that's not the case. That is not just when you get later in life. So first of all, again, let's define a little bit. What does erectile dysfunction mean? Because I'm pretty sure there's some misconceptions about what qualifies as erectile dysfunction.
I'll let you start on that one, Denisha.
Okay. So I just want to start off first before I even chat. I want to first state, just to make sure not being disrespectful to any other genders, I'm going to be specifically addressing those who are assigned male at birth. Just want to make sure I note that, so we're not being disrespectful to other genders. But based on the research I have done and what I've learned, because I am also still learning about this topic as well. This is still new for me. I don't know very much about, male anatomy and some of the male dysfunctions that come with sexuality. But with the research I have done, erectile dysfunction has to do with your inability to either achieve an erection or maintain erection during sexual intercourse or masturbation if you do any type of solo sex. So that's pretty much what erectile dysfunction is. It can be caused by several different factors. That could be anything that is psychosexual. And when I say psychosexual, I mean anything that has to do with like mental health. If you're going through a lot of stress, have any type of distractions, that is something that can cause erectile dysfunction. You also have some physical traits that can also cause it, as in if you have any type of diabetes, anything that can interfere with your, your endocrine system, and that can cause you to have ED as well. Other type of like medical conditions. One of the others as well is hormonal. So we're talking about androgens, which has to do with, and please correct me if I'm wrong, because I do not know anything about androgens besides a little bit of research that I've done, because I've had patients come and tell me about them taking, the testosterone pills to try to bulk up. But I believe it has something to do with lowering the levels of testosterone. And if you have lower levels of testosterone, that can cause you to have erectile dysfunction, because those who are assigned male at birth, testosterone is one of those major hormones that is important for sexual functioning. If that is low, then you could possibly have some issues with erectile dysfunction.
Spot on. No, it's interesting, because a lot of the things that you brought up from the physical side, the older guys that you see in the Cialis and the Viagra commercials, those are the ones that have heart disease and blood flow issues and stuff like that. And that's really what those pills are made for. They improve blood flow down to the tissue in the penis, and they keep it there longer. They also work for blood pressure, which is what they were initially intended to do. And honestly, the students that we see with this problem don't physically have that problem, okay? Some of them do. Some of them are more geared towards thyroid issues or diabetes or other endocrine issues, and some of them are low testosterone situations. So we do a lot of testing, blood testing on hormone levels and endocrine levels when people come in with this problem. But there's so much aspect of the psychosexual part of this that's not just, stress or anxiety or depression that's going on now. Our students are a population where many of them are just discovering their sexuality, and there's a lot of cultural and family baggage that they bring to that. They see people with different upbringings and different cultural lifestyles, and they're adjusting to it here on campus. There's so many different varieties of that here on campus. So they may see somebody who's, free and going out with people all the time and a lot of sexual partners. And they, on the other hand, might feel more guilty or have hang-ups about stuff. And that can definitely affect sexual performance. One of the things we always ask these students when they come in is, is this something that happens by yourself, or is it something that happens more with a partner or a specific partner? We've got students here that have suffered sexual trauma and abuse, and those things play a factor in trying to psychosexually learn how to be a sexually active person. And so there's a lot of different nuances to this problem with students that go far beyond just the physical aspects of it.
And, talk about the psychological or the psychosexual is a big part of it, because it can become a cyclical thing that a person has struggles with maintaining or achieving erection, and then they feel some shame or some doubt, and that causes more times when you fail to achieve an erection, which causes more doubt, and they can kind of build on that. And so it's, like you said, it's not just the physical, that mental plays a huge part in it too. One thing that that you mentioned in the prep that I think is important to address is that, for instance, if I come in and say I'm diabetic, that's pretty much I'm diabetic all the time, my whole life kind of deal. Okay. ED is not necessarily an all or nothing kind of idea. It's not that I will never be able to, I will always struggle with achieving erection, or it could be just during this time period. Is that correct?
That's totally true.
And so, so if you're running into that kind of issue, if you're working through that kind of issue, what do you do? What if someone says, I identify with that, I'm struggling in these areas, I'm struggling with maintaining or achieving or whatever you have, what do they do about it? What's their next steps?
When they come in to see us, like I said, we'll do some labs, make sure that we're not dealing with, low testosterone or other hormonal or endocrine issues. We'll talk with them about their situation and find out, specifically, do they have trouble getting an erection or maintaining an erection or difficulty reaching climax? There are medications that people take, such as SSRIs for depression, which can cause reduced sex drive or anorgasmia where people can't reach climax. And we can adjust medications and give other things along that way. I mentioned that, the little blue pill, we use it mainly for physical aspects of ED, but it does have psychological aspects of it. Knowing that you got a pill can make a big difference with people. And physiologically, in someone who does not have blood flow problems to the penis, when they take a pill like Viagra or Cialis, it does actually have a physical effect. It reduces the refractory period to a new erection after climax. And so there are benefits to it, right? I'm not promoting this for anybody to come in and start asking for it, okay? But we do use that here for people because it can be helpful and beneficial to people. I mean, the goal is not to have them needing Viagra every time they want to go have a sexual encounter, but it can be helpful in getting them to the point where they can do this successfully without worries and concerns.
Yeah. No, go ahead, Denisha.
I was going to include there's also other things that you can do if you don't want to take an actual pill, the little blue pill. With like the research I have done, and I found it very fascinating to kind of see that there are exercises that you can do that can help you with strengthening the pelvic muscle. That's one of the biggest things, or one of the most major muscles that we use when we're having sex is our pelvic muscle. So you can practice things like strengthening your pelvic muscle, whether you go to the gym and do exercises at the gym, or there's exercises you can do at home in your own private space to help strengthen that muscle. There's also a lot of things that you can do with helping strengthen your mental state and making sure that, you're helping yourself with alleviating distractions, because distractions can be huge when it comes to ED, because sometimes it's just we're too focused on our performance and we have that anxiety as soon as we're about to jump into intercourse that, okay, now I have to perform a certain way, and that's all you're thinking about. during your whole sexual experience. So there are different things you can do without having to take the pill to help, strengthen that pelvic muscle or just strengthen your mental state to be able to deal with those distractions.
Yeah, I would just underscore what Denisha just said. I think we all try to avoid prescribing Viagra or Cialis or the little blue pill, as Todd calls it. The vast majority of our students are anatomically normal and vascularly normal, and they have morning erections just like they're supposed to have, and they're able to masturbate successfully, and their problems with erectile dysfunction are in the setting of the sex, having intercourse, and it is in the psychosexual realm. So the tools and techniques that Denisha just outlined are really, really important.
And that's one of the things I wanted to make sure we address is that one of the keys is just talking to somebody. If you're dealing with this, if you're struggling, if you have questions, not even if you're dealing with ED, if you have questions, just want to be aware of what to look for, signs, what to do. Come make an appointment with one of our providers here at McKinley in the clinic, or come make an appointment with Denisha in Health Ed. Those are two similar but yet different avenues that you can go and talk to somebody, and they're interrelated, but it's different starts. And so it's a good place for people to consider that, hey, this is the first step I want to make, but there's a couple different options. The other thing that you're talking about in exercises and medications and things like that, but talk to your partner. It can be a scary conversation. It can, but I don't want to downplay that. But it's so important for any of us to be self-aware when it comes to sexuality, and to discuss with whatever partners we may have, what our expectations are, what our feelings are around that, our comfort levels, things like that. And so one of the biggest ways to combat ED is to talk to a partner and find that level of comfort together and that level of understanding that helps reinforce this is a safe place. This is a thing that we can work through together. That kind of idea. I think that's really key. Am I off base on this, or is that what you would agree with?
No, I would agree. I would definitely agree, because I feel like I've had patients come and talk to me about being able to get an erection and maybe not getting a strong enough erection because they're not aroused enough. And it could possibly just be your partner's not doing the things that you need them to do to make sure that you're fully aroused. Because if you're not fully aroused, then you might lose your erection during sex. So having that conversation about what feels good to you, what doesn't feel good to you, where you want to be touched, how you want to be touched, and just setting those boundaries can be really important to make sure that you're getting what you're wanting and what you need during your sexual experience, so it's pleasurable for you.
See, this is why we're very fortunate to have Denisha here on campus. The fact that we have a sexual health educator here at McKinley is a huge benefit to our student population. Like I said, you can make an appointment and come in, we can do labs and talk about things, but we have the opportunity then to say, you should really go talk to the sexual health educator. And you don't even need a referral from us on the medical side for that. You can dial a nurse and say, hey, I'd like to talk with the sexual health educator. And it's a great benefit that we have here at McKinley.
And it's one of the things I love about working here and being part of this organization, this unit, is that we really try it to the best of our ability with the resources that we have to cover the whole of a person, the mind, body, and spirit, and as much as we possibly can, to give that opportunity to support in every way. So you're right. You can come talk to a provider, you can come talk to an educator, you can do a combination of the two. But we are really here and passionate about helping students, passionate about putting them in position to find answers, to have the best support they can possibly have, to be the best they can possibly be. And so with that, I do want to remind you that we always have resources in our bio. Todd set me up for a nice segue. I appreciate it. No, but we have resources in the bio of if you want to contact us, if you want to contact Health Ed, if you're not sure where to turn, we always have links there that you can follow up with. And please feel free to contact us at Healthy Illini or anyone here at McKinley, and we will get you in contact with who you need to talk to so we can put you on the path that will help you succeed. I really appreciate you all coming and talking today. It seems like it flew by really fast, but there was a lot of good advice and good instruction on the topics. And again, hopefully this will help someone who may be wondering, or maybe, being confronted with some of these issues, help them have an understanding of what's going on, and that they can come and speak here. So thank you so much for being here today. I appreciate it.
Thank you.
Thank you, Matt.
We have a large and diverse campus, and because of that, we have a large, diverse number of issues that our student body is facing day in and day out. And two of those that are not always easy to talk about are, androgen enhancement type medications, and also erectile dysfunction. And so hopefully if you're listening today and it's something that you've been dealing with, or you're just uncertain of, or a little wary of, we've helped to make it a little bit easier conversation. We'd love to continue the conversation with you. If you have questions, if you need some advice, if you need to speak with someone about where you're at in your own journey, please contact us. Please reach out to McKinley, reach out to Healthy Illini. We would be happy to step alongside with you and help you walk that journey. But thank you for joining us today. You are on a personal journey, no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.